My name is Raffaele Rauso. I come from Italy. I worked up to
So this is the one we
2022 at the University Hospital. Then I shifted totally to private practice. In my talk, it will be a sort of consideration regarding abdominoplasty and the evolution
only facial
of
implant that
what
I've ever
patients are looking for in abdominal
and I
area.
don't even know what those are.
We know that abdominoplasty, of course, is a wonderful surgical procedures to solve the problems that can raise up after bariatric surgery, for example. This is a patient of mine just 2 months following circumferential abdominoplasty, and this operation is really important for those kind of patients because it dramatically changed their quality of life. And what I think is really, really important is that in medical literature, we have so many papers speaking about abdominoplasty and its evolution. Because actually, we have several techniques about the abdominoplasty, but we started from a simple dermal lipectomy more than 60 years ago. Um, why we need so many techniques? Because we have a plethora of clinical cases, and of course, we have often to combine techniques and perform a surgical optimization for each patient. On average, I operate 150 abdominoplasty per year, and I try to divide my patient in four classes of patients: WLP, PSP, PPP, and PEP. Um, about W, I'm speaking about weight loss patients, and usually the issues are that there's low tissue elasticity and usually a small amount of subcutaneous fat. Um, Tension suture are really useful in those kind of patients or to get a better control of the lateral area of the abdomen. And of course, it's really important to take care about what there is around the abdominal area because usually weight loss patients just do not have skin in the abdominal area, but or in surroundings. And the only bad things about this kind of patient is that often and often we have a poor scar quality. Let's take this patient, for example, how I told you it's really important to customize the results and to use um, pensions. Uh, in this case, usually these patient, main patients, are claiming about down of the penis, for example, and this is why to try to treat also the pubis area a little bit. In fact, in this case, the base of the penis is a little bit higher compared to the pre-op. BPP patients, I mean post-pregnancy patients, usually in my practice, they are a little bit overweight and there is so a moderate amount of subcutaneous fat. This is why often I perform other Saldana technique, the so-called lipoabdominoplasty, or I have combined techniques to have good results. And usually we can also record the diastasis recti, usually from 2 to 4 centimeters on average. This is an example of a patient 2 years following pregnancy. You can see that it's a little bit overweight. So in this case, usually I perform a application of the midline, but I also add two applications inside laterally to have a better control. And this is the result 3 months post-operative, and this is 8 months post-op. This is the patient pre-op and post-op. But to get a good result, a long-lasting result, sometimes we have to add something more. For example, when patients are more than a little bit overweight, of course, we have to perform a total evaluation. So in this case, we can combine liposuction of the dorsal area. I do not use energy-based device. I just use the so-called tridimensional liposuction with different diameters of the cannulas, just to get the retraction of the skin. And about the abdominal area, usually when patient during pregnancy gained a lot of kilos, more than 20 kilos, in my practice, muscle are really thin. So I had to the application, I apply a resorbable mesh just above the fascia, nothing special. And this helps me to have a stable result during the time. I started applying larger mesh, always resorbable when I put subcutaneous, but I noticed that there was no advantage. So actually, I just put along the middle line. And this is the result 3 months post-op, and this is 1 year post-op. And this is the patient comparison pre-op and post-op. Then we can identify the so PSP, the post-surgical patient. I'm not speaking about patients that already performed abdominoplasty, but patients that for some reason need abdominoplasty to hide previous scar or to other problems. In fact, in this case, it's really important to perform a scar evaluation, what there is, and abdominal wall evaluation, especially when general surgery operation was made. And often we have a limited skin access because those kind of patients are not exactly the good candidate for an abdominoplasty. But for example, when this 43-year-old lady with this scar came to me, she asked something to hide the scar. So a scar revision, of course, was not what she was looking for. And so we planned for an abdominoplasty. You can see that in pre-op mark, I try to um, take off all the area where the scars were present. And this is the immediate result and the 1 year result. And last but not last, we have also the so-called PP patient, pathological patient. And in this case, of course, it's mandatory a CT scan in order to perform a good evaluation of abdominal wall. Often there is need for abdominal wall reconstruction and also redraping of the skin. This is a patient that came to my office. What is interesting is next video that I am trying to show you. Okay, you can see when she contracted abdominal muscles, there was an herniation of abdominal viscera. And so in this case, we need to go a little bit deeper. We have to go behind rectus muscles. We have to release the internal fascia that in order to separate in the right way viscera from the abdominal wall. And now we have, first of all, to suture internal fascia. And then at this point, before to suture the muscles, I used to apply a mesh in order to be sure that I got a stability during the time. And so in this case, I prefer to apply large meshes. Then I have just to close the muscle along the midline, as you can see in the video on the right, and the result. This was sent me by the patient 4 months following surgery because she was a patient coming from abroad, and this is the comparison between pre-op and post-op. Abdominal area often is also really useful to solve some cardiothoracic patients. In this case, I was called by cardiothoracic colleagues that after heart surgery, they had this wound that did not heal after 3 months. The patient was really old, so it was not a good idea to perform a free flap. So I planned a ramp flap, and this is the immediate result at the end of surgery, and this is the result 3 weeks following surgery. You can see that the skin is totally alive. So the concept is we actually know almost everything about abdominoplasty and how to raise abdominal flap, how to reconstruct um, abdominal wall. But do we need more, or are our patients looking for something different? If we Google HD liposuction, we can see that we have thousands of results. And if I look at those results, sometimes they look unbelievable. I mean, there are some cases that I would have performed a classic abdominoplasty or a lipoabdominoplasty. But in these cases, you can see the post-op with no scar and muscle definition. But if we search on PubMed, HD and liposuction, just 19 results come out. And above these 19 results, we can see that a lot of them doesn't speak about HD liposuction. So after the evaluation of these 19 results, just 5 articles were focused on HD liposuction. But if we perform another search, abdominal HD liposuction, so more specific on abdominal area, you can see that we have just 5 results, and just 2 articles are focused on abdominal liposuction. So we can see that there's much more on Google than on PubMed. That this is quite strange for scientific community. The problem is that, for example, this is a colleague that was sending me by WhatsApp a picture of his wife, telling me, this is my wife, she would like to reach this result, and was taken on internet, on Instagram by another surgeon, because there are some colleagues that claim that this is the good way to get wonderful results. But I'm not against abdominal definition. I think that we should achieve a light definition, but not a total definition using the energy-based device. Because if we have a skin retraction and some fat that looks like muscles, what happens after 10 years, after years? I try to ask this question also to colleagues really focused about HD definition, and they reply to me, I don't know, we have to see, we need time. But I'm really afraid about those kind of retraction. Also because in my practice, I see a lot of these patients not treated by me, but they come to me because they have this kind of complication. This is another one where they perform a lipoabdominoplasty, an abdominoplasty and HD liposuction of the abdominal area. You can see this is not a flap necrosis due to the undermining, wrong undermining. This is a necrosis due to the use of energy-based device. And this is one more case. So I'm a little bit afraid about what can happen. Because of course, also in traditional abdominoplasty or lipoabdominoplasty, we can have complications. But usually, complication is something like conditions. And also a resident is able to solve this kind of problem. But when we have this kind of problem, how can we help our patient? How can we deal with it? And I try usually to treat them with several medications using of platelet-rich plasma, and at the end to perform a sort of surgical revision. But you can see how high is the scar, how the umbilicus is next to the scar. So the concept is that I just closed the wound, but this is not an aesthetic result. But if we look on PubMed, we can see that in 2023 on PRS, it was published in a systematic review about efficacy and complication of high definition liposuction, and they concluded that minor complication rates across the entirety of the literature reviews were 0.2%. So I just wonder, maybe all the cases that I see during my practice of complications, probably they are not published, because 0.2% is really low. And believe me, every month I can see one, two patients with this kind of complication. So the percentage maybe is not so small. I'm not against evolution and use of energy-based device, but as artificial intelligence, we need to know when and how to use. The innovation is not always for all the patients. Because if we compare on PubMed abdominoplasty and abdominal HD liposuction, we go from over 2,500 results to 5 results. So maybe at this moment, we need to study a little bit more to really understand the right candidate for an HD definition of the abdominal area or also of other areas, because the concept is the use of energy-based device associated with or less with surgery. But think it's really important. If I treat a 35, 38-year-old boy that are looking for a six-pack definition, all the retraction, how will become within 20 years when he will be 60-year-old? I don't know. Will be that result good aesthetically? Will be that result, if that result will be not good, how can we solve if we have skin retraction? You know, there are too many questions that need to be answered. So it's always really important to look ahead, but what is really, really important is also to remember the past. And because the concept is that those who cannot remember the past are condemned to repeat it, of course. And so my thought is ended, and it's just also to ask to you, to the chair, and to other colleagues, what do you think about those considerations that I gave you in this speech? Thank you.